Hey everyone, welcome back. I'm Dr. Perkins, your board certified OBGYN, and today we're going to be talking about how do you know if you have bacterial vaginosis. By the end of this video, you will have an understanding of what is bacterial vaginosis, which bacteria causes this infection, signs and symptoms of this infection, and the best way to know if you have bacterial vaginosis. Let's dive into it. So what is bacterial vaginosis? Well, bacterial vaginosis, we sometimes will refer to as BV, is an infection of the vaginal area. It's an infection that is caused by a bacteria that normally lives in your vagina. That bacteria is called Gardnerella vaginalis. Now, this bacteria was found back in the 1950s with people doing research and really trying to figure out what is happening in women with vaginitis, or an infection of the vagina. And what they realized at that point is that most of these infections are caused by this bacteria, Gardnerella vaginalis. This bacteria, however, lives in everyone's vaginas. We've also since then noticed that there are other bacteria that can cause this infection as well. However, Gardnerella just pretty much runs the show and causes most of the infections. Some of the other bacteria that causes this is Atropium vaginalis and also Megaspira. I really mention this because sometimes when your doctors will test your vaginal discharge and give you a report, you may notice that you have several different bacteria listed there, which might not be Gardnerella vaginalis. Overall, the infection is caused by a bacteria that lives in your vagina but overgrows. Let's dive into this more. Gardnerella vaginalis protects your vagina. It is like the soldiers or the security for your vagina. It keeps your vaginal space intact with acid. Your vagina loves to be acidic, somewhere between 3.8 and 4.5 on the pH scale. It also protects the vagina by making sure that all the other bacteria and yeast that lives there remain in their normal amounts. It is completely protective. However, if there is an imbalance of some type, anything that disrupts your pH level, your level of acidity, your vaginal space, this bacteria may overgrow. It is also important that we talk about lactobacillus. This is another bacteria that really balances out the Gardnerella in your vagina. If your lactobacillus is a little bit too low or there's too much of it, this may also cause an overgrowth of the Gardnerella. Anything that causes your vaginal pH to be thrown off can cause a bacterial vaginosis infection. Let's talk about this. So I know you want to know, well, how do I know if I have bacterial vaginosis? Well, you may have symptoms of this infection, which may just be simply a change in your vaginal discharge. For instance, your discharge might be a little bit more runny, might be a little bit more watery. Some people may notice like a little bit of bubbles or a foamy look to your discharge, or even a color change. For instance, your discharge may be very gray, maybe a little yellow, or it could be a little green. As you can imagine, the symptoms vary from person to person and might not look the same. So again, if you're concerned that you may be having bacterial vaginosis, the best thing to do is to see your provider so they can take a look at your discharge and examine it very closely. Are you interested in this topic? I do videos on this all the time. Like and subscribe. Here's a fact that I really want you to know. 50% of people with this infection have no symptoms at all. So you might have this and not know, or you might find out when you're getting tested for something else. For instance, you're getting an STD panel or getting your annual exam and you get a pap smear and you may get results for bacterial vaginosis. And I say this because sometimes people get thrown off like, well, I don't feel anything. I feel completely normal. How do I have an infection? Well, this infection can stay silent in your body until someone tells you that you have it. Now, your doctors will do a pelvic exam when testing for this infection that incorporates having a speculum exam and taking a look closer at your discharge. They will take a sample of that discharge, place it on a slide, look under the microscope, looking for things that are linked with or the bacteria that causes bacterial vaginosis. Again, Gardnerella. When your doctors take a look under the microscope, they're looking for things like a clue cell. That is significant of the Gardnerella vaginalis bacteria. Another test that your doctors may do is they may add potassium hydroxide to that slide and do a whiff test. Why? Because if you do have bacterial vaginosis, a fishy odor is very common, and sometimes that's the only symptoms that people will have to kind of tell them and stimulate the thought that you might be having a BV infection. The whiff test does the same thing, but your doctor does it on a slide. Your doctors may also opt to send your discharge sample off to the lab for testing. That's where you may get a report, and that report will break down which bacteria is present and overgrown causing your infection. A common question that people may ask is, what does a male have to do with this infection? Okay, there are some myths surrounding this, but let's talk about the facts. Fact number 1, bacterial vaginosis is caused by bacteria living in the vaginal area. Bacterial vaginosis is not carried by a male counterpart. They do not carry the Gardnerella vaginalis bacteria. However, sexual activity with a male may cause your pH to be thrown off, which makes your bacteria Gardnerella vaginalis overgrow. Semen has a higher pH level. On average, somewhere between 7, 8.2 level, which is more neutral or basic. The vaginal space prefers to be acidic. So when semen meets with the vaginal area, the two neutralizes. In the end, your pH rises and makes the bacteria unhappy. And so in an effort to correct the problem, the Gardnerella vaginalis will overgrow in efforts to control the infection. But what it does is it causes more of an infection. So this is how a male partner may play a part here. They're not giving you the infection. However, semen in and of itself naturally can cause your bacteria to overgrow. Now, the best way for you to know whether or not you have this infection is always to go to your doctors. Now, some people may be very well versed with how their body feels or having this fishy odor. And so if that's your scenario, the best treatment option is to get a prescription antibiotic that will completely bring your bacteria back to normal levels. There are other options as well with home treatments such as boric acid, but you do want to talk to your doctor before trying these methods just to make sure that the formulation and dosage is perfect for you. Now, if you enjoyed this video today, you can go ahead and click the link below to receive my free ebook on hormone balancing. Now, this might not be directly related to our bacterial vaginosis today. However, we will talk about in this ebook how to better balance your overall body, which will provide the best space for your vaginal area and bacteria to live in. This is Dr. Perkins, your board certified OBGYN. As always, it's such a pleasure talking to you about your body and common infections such as this. Have a great day.